Who am I here with today?
I'm Dr. Cody Kaneshiro. I'm a licensed clinical psychologist.
Dr. Cody, what does mental health mean to you personally?
Um, I kind of think like you can be physically healthy and that's great, but if you're mentally not well, then, it kind of doesn't really matter, right? So I kind of think it's sort of the foundation for health.
Nice. And what brought you into the field of mental health psychology?
The short answer is that kind of like what I mentioned before, I tell people I kind of came into psychology as a um, canceling out a lot of other options because to me it kind of seemed like at the end of the day that's what was the most important thing. But originally kind of started out in the knowing I wanted to go into healthcare, but as I thought about chronic disease and the treatment of it, to me a lot of it came down to behavior change and modifying that. And so again, like if people aren't feeling well, then kind of seems like that's where you got to start.
Can you tell us a little bit about the work you're doing these days?
Yeah, so I wear a few different hats. Currently, actually, just completed my postdoc, so I'll be starting a full-time staff position with VA Pacific Islands in December, doing primary care psychology. Also opening up a private practice, both serving all the 9 islands, so both Hawaii and Nevada. So I'm working towards licensure in both. And I'm also the training director for the Hawaiʻi Behavioral Health Connection. So we work on providing free clinical and professional trainings for mental health clinicians in the state of Hawaii.
Nice. Can you tell us a little bit more about Hawaiʻi Behavioral Health Connection, what it does for the community?
Yeah, so you have kind of two main aims. The first is, like I mentioned, free trainings, and that kind of takes all different shapes and forms. So supervision trainings for students and student-geared kind of events, trainings for practitioners to improve their practice and really trying to implement evidence-based treatments here in Hawaii. And also cultural events, so things like Malama Aina events and other cultural and community events, and public-facing events as well. So going to different fairs and community kind of organized celebrations and trying to spread the health word of mental health that way. The other aim is on a directory, so we hope to remove some of the barriers for people seeking mental health care. So we have a directory that's managed by licensed mental health providers here that sort of tries to connect those seeking services with the service providers themselves on all the islands.
So for you, when life gets a little hectic, let's call it, what are some of the things you do to get grounded?
I've learned the importance of sleep. So I think that's kind of like number one that I'm working on nowadays. But otherwise, for me, I really get a lot out of just like being active. So not necessarily even like sports or like working out, but just like, going and making an effort to see friends, going and making an effort to like use my body. So like go hiking, go swimming, or even just like getting out of my house. To me, like that kind of helps me to reset my mental space.
What's your biggest piece of advice for someone who wants to get into the mental health field?
I would say to explore your options. I think both the blessing and the curse of mental health is that there really is no one size fits all path. So there's a lot of different avenues that you can take. And the pro to it really is that I think, with this degree, it's super flexible. You can really work in a lot of different environments and a lot of different roles without the need of respecialization or of getting retrained.
Nice. And then last couple questions. So what do you wish that they taught kids about mental health? Let's say like middle school or high school. What do you wish they taught about mental health in those ages?
Oh, you're asking a pretty deep question here. I think probably a really important thing is I think just to validate, I think that, like feelings form a function and I think they point at something important. Um, I think it's hard for, especially like younger adults, the younger they are, I think it's harder to really like truly let that sink in. But I think the more that we can spread awareness about that, I think that'll kind of be a seed planted for a lifetime of growth. That'll be really helpful.
Thank you for that. And our last question of our podcast. So our show is called Listen to Your Heart. So Dr. Cody, when you listen to your heart, what's it saying?
Sleep more. But I think really it's, I think I had my advisor in graduate school said if something's worth doing, it's worth doing poorly. And that really like bothered me for a long time because I kind of always was, we learn to do something well. But I think the more that I see this work and the needs in the community, the more I think it's really true that, if something's worth doing, the fact that you're doing it at all is sort of a job well done. So don't stop there. But, I think just to keep pushing through, that's kind of helped me a lot.
Dr. Cody, thank you so much for doing this, man.
Thank you.
Yeah.
And thank you for tuning in to Heartbeats.
If you'd like to support our mission, check out the link in our bio to visit our store or make a donation to our nonprofit, Imua Heart. Together, we can imua towards a happier, healthier Hawaii. Until next time, mahalo.